For this, for this particular one, guys, you're going to be testing against gravity and trace in the same position. Normally, we do trace where? Gravity minimized, right? Okay. So we're going to let her hang with her hands off. All right. And what are we doing here, guys? Scapular adduction, so mid-traps. Okay? So, if I'm looking to test for this side, the goal is for her to bring her arm up like so. All right? We're not looking for her to bring her arm up and rotate like this. If I see that doing a practical, we did something wrong. All right? So what's happened at the scapula?
Adducting.
Adducting, right? So remember we talked about the difference in horizontal AD and AB and scapular motions, right? So that would be a 3. If we're looking for a 3+, a 4, and a 5, we're going to be resisting at the medial aspect of the scap. Usually a little pressure like this works. You're not really going to be in there like this. It doesn't really work too well. All right? I'm going to ask you to repeat that motion. This is not something you have to go to town with. This is not like knee extension. All right? A little resistance is a lot of resistance here. All right? Trace, it's the same exact thing. You're in this position. So that is obviously going to be a question that we ask you because it's something different. Okay? Against gravity, gravity minimized, we'd have her sitting in a chair. You can sit up. Anybody got a towel? Thank you so much. How are we doing so far, guys? You all right? Okay. Picture perfect world, all right? We'd like to have her arms up here, everything at 90 degrees flexion. And what she's looking to do is to reproduce that same exact motion that she just produced. So she's looking to, come a little closer. She's looking to bring everything together like so, on a friction-free surface. So technically, I'd like to have this table a little higher. We're working with what we have. We'll kind of state that to us, right? State you want 90 degrees of flexion, all right? 90 degrees of bend at the elbow. And we're looking literally to get the scapula to come closer together. Any questions? That's it, guys. Have a nice day. You did great. You lie on your stomach? All right, so next one is going to be downward rotation. So this one's another funky one, all right? So what we're looking to have her do, have your patient slide as far over on the table as they can. Bring the legs this way. Bring your body that way a little bit. All right, we want the shoulder in about 130 degrees. A baby abduction, thumb up.
Can you move the skeleton?
Skeleton?
Yeah.
Okay. So what's doing this, guys? This is a motion that goes straight up like so. Not rhomboids. Lower traps. All right? So this is for lower traps. Okay? Very easy. Prone for all of the tests here. From 0 to 5. Okay? It gets a little funky. You have to know where you are. All right? You're basically going to be on the medial spine of the scap. All right? On the opposite side. So I'd be on this side over here. Between 6 to 12. T6 to 12. And you're going to ask her to bring her thumb up towards the ceiling. Okay? If the patient, well, if you're looking for trace, you're just going to palpate between T6 to T12, medial aspect of the scap. All right, you want to have a palpable contraction. Is there going to be movement? No. No. Okay. For a trace plus, less than half of the available range. So I ask her to go up, and she comes up and dropped. For a poor, half the range. Poor plus, slightly more than half the range. All right. Now, guys, this is going to be you kind of doing the full test. You're going to look and say, here's my passive. I know what full range is. So you'll know what everything is then. Okay. If it's trace plus versus poor plus, you have to kind of, it's a little vague. It's a little hard. It's a little hard to understand this. All right. So then a trace plus, a poor plus, slightly more than half, but not full. All right. If you go in a fair to full range, she comes all the way up. Good is going to be resistance applied, all right? Minimal, a little more than minimal min mod, all right? And normal is full resistance applied. Again, you would be on this side, ask her to come up, and you're resisting medial aspect of the scap, all right? So prone for all positions. I know this is a lot, guys. I know the scap motions are harder, okay? It's going to be a lot of practice.
That was scapular adduction and downward rotation.
Scapular adduction and depression. Okay? Scapula adduction and downward rotation, that is rhomboids. Okay? So for that one, she'd come right back into the middle. She'd put one arm behind her back, like so. This is going to be against gravity. Okay? So what you'd ask her to do is to lift her hand off her back. Now the biggest thing you guys are going to do wrong is you're going to resist down here. Your resistance is on the humerus. All right? So if she can do that, that's a what?
Normal.
That's a 3. All right? If you give what? What's a 4?
Matter of
Same thing we've been going through, yeah? And then a 5? Okay. Again, be joint specific. Think about where you are. I'm not going to come here like it's knee extensors and go, okay, lift up. Come on, man. You know, you just got to think about where you are, guys. All right? Gravity minimized. She'd be sitting in a chair. Okay? She'd put her hand right behind it. We'll turn you the other way, actually. Okay, let's turn this way. Hand behind her back. All right, you'd ask her to do the same exact thing. All right? And the same thing we've been going through. All right, that makes sense? Not so bad, right? Yeah. All right. Last but not least, protraction, scapular abduction, and upward rotation. So we're going to put, is there a side that's better, buddy?
Let's see. Top?
Top's fine.
Shift.
So guys, last one. All right, let's get a little closer. Again, you want the arm at about 90 degrees of flexion. A lot of you guys here work at clinics and have told me you've done scap punches, right? It's a matter of doing them properly, right? So you're looking for serratus. It's a little bit of a harder thing to palpate, all right? Serratus is basically what ribs? Ribs 1, 2, 8, 9, depending upon the source you read, right? Okay. I have somebody right now that has a long thoracic nerve injury, so we'll have some weakness there, correct? All right. Big thing here is you want a punch. You don't want a rotation, all right? You're looking just to get that protraction moment, okay? Here you're picking up the slack if you're giving a 2+ resistance and your resistance is going back. So I'd be right behind, stabilizing on her. Again, it would be on the table. We'd be right at 90 degrees. So technically speaking, I'd like this table a little bit higher, but for the purpose of this, we'll keep her like that. I'm going to pick up the slack, stabilize up top, and say go ahead and punch. And that's a what? 2+, right? This is what, horizontal or vertical?
Horizontal.
Horizontal, okay? Now, if we wanted to do against gravity, we'd have her lie on her back. Slightly different this time, guys. Have her bend her arm like so, and we'd be applying resistance through the elbow. So I'd ask you to do the same thing. That would be a what? 3. And then a 3+, 4, and a 5 would be through here. Again, right there, you can stabilize, make sure she stays down. Go ahead and punch. Good. And that's how you delineate a 3, 4, and 5. All right? Yes, you have a question? Any questions? Is everybody overwhelmed? This is the most quiet I've ever seen you guys.
Where were you stabilizing?
Stabilize it. Does he really stay where he wants to stabilize there, Joe? I think just at the thorax is fine.
Yeah,
He doesn't really stay. He doesn't really state where he wants stabilization. I mean, don't stabilize so much that you kind of keep them down and stop the motion. All right, but you kind of stabilizing thorax, making sure they're not rotating. All right.
He just shows the hand on lateral thorax exactly, just so you don't allow any thoracic rotation.
All right. And again, while you're there, if you're checking for trace, you can kind of be in that area. Again, it's sort of difficult to feel for it, but just know the general area for palpation. All right. I know it's a ton, guys. It's a lot. I know it's a lot going on this semester. Practice as best you can. There's 5 of them. Is it? Yes. I can keep going. That was really nice of you. Just keep going, guys. Just keep plugging away because there's a bunch more after this. But I mean, you just have to make sure as you're doing it, you're saying what you're doing. Don't just say it's lower traps. Say what the motion is. That's how it's going to get into your head. Okay. Yes.
For the substitutions, besides like rotating your body or leaving the plane,
Sure.
are there any other types of
I mean,
substitutions?
you want to watch, make sure there's no elevation going on and things of that nature. Just look for the obvious.
Even with the other,
With everything, yeah. At this point, I mean, you're not babies with kinesis anymore. Like, look for the obvious. You're going to see substitutions. And if you cannot see a substitution, always go into a substitution. Force the patient into it, so you force to see it. All right. A lot of you guys before with extension were like, I don't know if I'm at the end. Well, take a step back, have them do it. You'll see them abduct. All right. With abduction, you'll see them come out of the coronal plane and go into that scapular plane. Always go into it while you're learning it, so you know where it is. Even during the practical, if they substitute, back off, and then you know where. Then you have a general idea in your head. All right. It will be obvious. You'll see her rotate. You'll see her shrug up and then do it. She'll come past 90 or be less than 90. Because if we're past or less, it's going to change everything too. We don't want her having a force going over towards Frank over there. We don't want to have her having a force go towards Joel, right? It's purely up. So, the common substitutions. Okay? All right, guys, let's go ahead and practice.